Okay, I think we'll get started now. So good afternoon, everyone. Thank you for joining us for today's webinar titled Engaging Young People Who Use Drugs, Cannabis, and Beyond, brought to you by the Canadian Public Health Association as part of the Normalizing Conversations project. I appreciate everyone taking the time to be here today. My name is Alexi Kim. I use she, her pronouns, and I'm a project officer with CPHA, and I'll be introducing today's webinar as well as our moderator. So before we begin, we want to acknowledge that the Canadian Public Health Association's office are situated on the ancestral and unceded territory of the Algonquin Anishinaabe. They have been the guardians of this land for millennia, and we're grateful for the example their stewardship provides. I recognize that working towards reconciliation goes far beyond this acknowledgement. And while CPHA is making strides to embed truth and reconciliation in our work, we encourage you to learn more about the land that you live on and embrace opportunities to learn from Indigenous people and communities across Turtle Island. I myself work for CPHA, but I'm joining from Tiohtià:ke, which is Montreal, which is the traditional territory of the Kanien'kehá:ka and has long been a site for meeting and exchange amongst many First Nations. I recognize that I'm a guest on these ancestral lands, and I'm truly grateful for the privilege to live and work here. So to provide a little bit of background, in 2020, CPHA was funded for a project titled Normalizing Conversations, Engaging Public Health, Public Safety, and Communities to Build Capacity for a Public Health Approach to Substance Use. And this project has involved working with communities across Canada and creating and updating the Canadian Substance Use Resource and Knowledge Exchange Centre, which many will know as SURE, or can be accessed at substanceuse.ca, as well as publishing resources that can be used by a range of professionals across Canada to utilize and implement a public health approach to substance use. So you can find more information about the project at substanceuse.ca or by signing up for the SURE monthly newsletter, where we share project updates and upcoming events, as well as recently added resources to the website. So just a quick little housekeeping notes. We strongly encourage attendee participation, and we really look forward to hearing your perspectives and questions today. If you have any questions for our presenters, please type them into a Q&A box at the bottom of your screen. You'll see there's a little Q&A, and then there's a chat. So please privilege the Q&A button for that. And then after our presentations, our moderator will read the questions, and our presenters will have the opportunity to answer and address some of your pressing questions. The second point is that this webinar is being recorded and will be made available on CPHA's YouTube channel and on the substanceuse.ca website a few days after the end of the presentation. And this will include the recording as well as the transcript and closed captioning. And finally, we really like to get your feedback. So after the webinar, please fill out our short survey. It'll open automatically as you click Zoom. And this feedback really helps us make these webinars what they are, and it gives us a better sense of what topics our audience wants to learn more about. So again, if anyone has any questions, please type them into the Q&A box below. You'll also see that there's a chat, and that is where my colleague Kelsey or panelists will be sharing links to different resources or addressing questions that are more of a tech or general information, of a general information scope. So without further ado, I will present our moderator for today's webinar. Rebecca Haynes-Saw. Rebecca Haynes-Saw is an associate professor in the Department of Community Health Sciences at the University of Calgary's Cummings School of Medicine. She is a public health sociologist and studies youth substance use through a harm reduction lens. Her recent projects have focused on youth and young adult cannabis use and opioid use, the family context of substance use, and parent advocacy for action on Canada's unregulated drug death emergency. We're really very fortunate and very grateful to have Rebecca moderating today's session. Rebecca has been involved in supporting CPHA projects and policy work for many years, and is an active member of the project's expert reference group, and provides much needed guidance and support on that group as well. So with that, I will turn it over to Rebecca to start the webinar.
Thank you so much, Alexi. I will just start off today by saying I'm just so thrilled to be here with this fantastic group and with the invitation from the CPHA to moderate this discussion. The CPHA has shown stellar leadership in advocating for a public health approach to substance use, and that includes for young people using substances. And I think this is so critical because, as the headlines I've put up on the slide here today show, across Canada, substance use among youth and youth using drugs has been weaponized by various political parties, media pundits, community groups, to advocate against human rights and care for youth who will use drugs. This is a fundamental issue beyond just this idea of protection, but also of human rights and autonomy and the right to safe environments and the right to make choices. We put a tremendous amount of pressure on young people to be responsible and independent. And then in many cases, they're not included. Their voices do not matter. And adults speak for what they believe will protect youth. And on the path to cannabis legalization, we saw this, very obviously with the Canadian Medical Association and other stakeholder groups saying that legalizing fails to protect young people, totally disregarding how being criminalized for cannabis use exacerbated deep inequities for Black and Brown communities, for Indigenous people especially. So there is that gap, and that's where I feel that the Canadian Public Health Association has shown remarkable leadership for us, for those of us who are working in this space with youth and are trying to do things on the ground and in our institutions. So if you could go to the next slide, I just want to provide a more hopeful example. When you bring youth to the table, it turns out they have a great deal of knowledge and capacity among youth who are former and current drug users to advocate for themselves and for the services and the type of system, but more importantly, the values and the orientation that they want from the system and their adult caregivers. And this is an example from a youth summit that we did under CRISM, the Canadian Research Initiative in Substance Misuse, at 5 sites across Canada with other youth substance use research leaders like Danya Fast and Rod Knight in BC, and then across the provinces across Canada, to bring youth together and ask them, what do you need for support? What does, a youth-centered approach to care, in this case for opioid use and opioid use disorder, look like? So I just want to remind people that this is the capacity that youth have. And the UN Declaration on the Rights of the Child do talk about youth protection, but fundamentally the thing that the pundits always miss is they always talk about the capacity for youth to be involved in any decision that affects their care. And I know a lot about that convention because in 1989, when it was being passed in Canada, along with the rest of the Degrassi cast, where I know a lot of people in Canada know me from, we were ambassadors for the Declaration on the Rights of the Child for Canada. So I will close there on that note, and I'm just absolutely thrilled to introduce these speakers and what they're going to share with us today. Okay, so quickly I'm going to do the rundown of our speakers, and this is a group that absolutely represents, I think, some of the best work that's happening with young people in Canada. So first off, we have Trevor Goodyear, and Trevor is currently based in Vancouver, and he's an RN and has a master's in public health. He's a PhD candidate in the School of Nursing at the University of British Columbia, and his research is in youth mental health, substance use, with a focus on youth experiencing overlapping structural inequities. And in his PhD work, he's using a participatory photography method to examine the intersection of homelessness and substance use among 2S LGBTQ+ youth. And Trevor is also an active member of the Trace Youth Cannabis Research Program, which, full disclosure, I co-lead with my colleague Emily Jenkins at the School of Nursing, who is Trevor's supervisor. We also have joining us Michelle Johnson, another person with a nursing background, but who has been a public health nurse for 23 years. And she's worked in many areas of public health and control of infectious disease, child and family health, healthy living, in the division where she works. And the focus has been always on children and youth in the areas of mental health, physical activity, substance use, including opioid and cannabis education, and more recently on concussion awareness and prevention. Joining Michelle is Harim Ashraf, another nursing background and Bachelor's of Science, who graduated just this September with an honors Bachelor of Science from York University. It's already making a mark in the field. And she received her degree in nursing from the University of Toronto and works in various roles, including writing, research, leadership, mental health advocacy, and is very passionate about increasing access to mental health resources and support within community settings. Then we have Kia Ellis-Doherty. She's a co-project lead for Get Sensible. This is from the Canadian Students for Sensible Drug Policy group that I have worked with as a strategic advisor in the past. And Kia studied comparative religion and political science at Concordia University, and they've been involved in several harm reduction initiatives, working with the CSSDP, the Heart Tattoo Society, Tides of Change, the Community Action Team, and the Cannabis and Mental Health Project. And Kia ensures their work is rooted in community, whether it's regarding harm reduction, drug policy reform, housing, food security, or social wellness. And she aims in her work to continue reducing barriers around drug education and harm reduction. And in their free time, Kia likes to nap, play rugby, and felt. We have then finally Noor Haddad joining us here from Calgary, where I am. And she's a substance use and mental health advocate focusing on harm reduction and recovery, drawing from her own lived experience. She earned a BA honors in psychology from the University of Calgary and currently works as a research coordinator for a program on campus supporting students and staff with substance use concerns. And Noor is also one of the project leads in Get Sensible, a national campaign on youth drug education that's part of Canadian Students for Drug Policy. So an absolute wonderful panel, and we give them applause. We welcome. So we'll turn it over to Trevor.
All right, everyone. I'm just pulling up the screen here. I can't see my slides, which is tricky, but give me one sec.
They were there.
Trevor, if you don't mind, I can reshare my screen and then we'll just give you remote control.
Perfect. Thank you. That looks better.
Okay,
Wonderful.
You should be getting remote control right now.
Great. Thanks so much. Yeah, well, hello, everyone. Thank you all for being here. It's great to have such a big turnout, over 100 people. Again, my name is Trevor Goodyear. I use he, him pronouns. And today I'm going to be presenting on the most recent iteration or sort of project from the TRACE study. And really today I'm going to be talking about youth cannabis use in the context of health and social inequities. And this is really what young people we spoke with referred to as health and social struggles. And we'll unpack that a little bit. And thank you for that land acknowledgement to begin. I would also like to acknowledge that I'm presenting from unceded Coast Salish territory, including the traditional homelands of the Musqueam, Squamish, and Tsleil-Waututh peoples. I only have about 12 minutes with everyone today, so I'm going to speed through things. But really, I'm couching this work within a broader program of research that's been ongoing for about 20 years now. So really, you're getting a taste for all of that TRACE has done the last 2 decades. And in terms of some of our key findings over the last 20 years, much of which has been before my time with the team, we've found out quite a bit about youth cannabis use. So first, motivations, patterns, and contexts of cannabis use vary quite widely among young people. So cannabis use doesn't look the same from one person to the next, and people use cannabis for many, many different reasons and in different contexts and ways. That said, we do know that youth use cannabis along a spectrum, so ranging from social use to relief-oriented use and to potentially harmful patterns of use. And in reality, people are often moving, back and forth along this spectrum, so it's not like a stagnant experience. Young people, as Rebecca was saying, are very active in taking up self and collective care strategies when it comes to substance use, including cannabis use. So taking a real active role in identifying and working to mitigate different harms that can come up in the context of substance use. And with cannabis now legalized, our work has really highlighted that policymakers and the support people in young people's lives really need to prioritize a harm reduction approach, or at least an abstinence plus approach, if we're going to meaningfully support young people to mitigate these harms. And I mentioned cannabis legalization. So cannabis has been legalized for about 5-6 years now. And with legalization, there's been a lot of concern about, rates of cannabis use increasing among young people, and the experiences of harm also, increasing and becoming more significant. In actual fact, we've seen that these rates have kind of stayed about the same and have not, gone up as much as others have speculated. And our research Our research is really set in the context of this legalization. And we're really looking at how young people today are using cannabis in the context of both, our legal landscape, but also in the context of, young people's day-to-day lives and how they're navigating different social issues like health and social inequities. We're doing this study with young people because cannabis use is high among this group. And we're really focusing on young people who are experiencing different health and social inequities, because we know that rates of cannabis risks and harms are inequitably distributed. So especially impacting young people who are marginalized along axes of gender, sexuality, race, ability, and so on. Youth who experience this marginalization are often labeled kind of at risk, and tend to be excluded or tokenized in much of cannabis policy and research. Our work is really responding to these, gaps, but also, areas for attention. And we're seeking to really work with equity-deserving youth to highlight their perspectives on cannabis use and placing this use in the broader context of young people's lives today. So this study has been on the go for about 2-3 years now, and we interviewed 56 young people from across Canada, for the most part in Alberta, BC, Quebec, and Ontario, but also elsewhere. Our interviews lasted about an hour to an hour and a half, and all of the young people we interviewed were invited to take part in a focus group. 17 actually did so. And with these 17 youth, we really had a chance to check in on what we were hearing from youth, refine our sort of analysis, and really make sure we were getting young people's stories right and telling them in a good way. We analyzed all of the interview and focus group data through a thematic lens, and really by leveraging, theories and critical drug studies. And I won't get into that, but if you have questions, I'm happy to tackle that in the Q&A. And we spoke with, I mentioned 56 young people, ranging in age from 15 to 24. And this slide is really highlighting that this was a diverse group of young people. So diverse in terms of gender identity, sexual orientation, ethno-racial background, and also the ways in which people were using cannabis. And one of the things we asked about was how often people are using cannabis. And in this group, it was quite frequent. So from daily use was quite common, or multiple times a week. And then some people use cannabis less often, but oftentimes had previously used it more intensively. And then we also had many folks in our study who described themselves as neurodiverse and who had lived experience of mental illness. And this is something that came up in our interviews. So from our analysis, we really developed 3 themes that capture how young people are using cannabis in the context of inequities. So first, we found that cannabis use is contextually produced. And by this, we mean that young people frequently connected their cannabis use to that broader social context of their lives. So their day-to-day lives and the social and health issues that they were grappling with at times. Young people told us pretty loud and clear that risks and harms tended to stem not from cannabis use per se, but from the different forms of hardship and inequity they were facing. So hardship and inequity related to policing, racism, colonialism, queerphobia, poverty, stigma, and violence. And really young people tended to locate their cannabis use within this broader context. So facing these issues, young people talked about using cannabis in really intentional and strategic ways, in many cases as a response to this hardship and inequity, and of course not in all cases. And to illustrate this, one participant, he shared, my cannabis use relates to just like issues or struggles that I face. When it comes to facing inequalities, there's a lot of times like inequalities really manifest themselves into real physical harm, violence, mental harm when those situations happen. And they have happened for sure. In those periods, my use of cannabis is very dynamic, responsive. In our second theme, we really looked at cannabis use as a practice of care. So young people tended to complicate or even outright resist the notion that cannabis was like a dysfunctional or kind of maladaptive coping strategy. Instead, they talked about using cannabis really intentionally and really drawing attention to their own agency and autonomy in the context of these inequities. And young people told us that cannabis can fill an unmet need, especially when other tools for, promoting mental health are not available or not accessible. Cannabis can help people to feel good and to do well. And young people, talked about cannabis as therapeutic, a form of escapism, self-medication, and other similar terms. Of course, some young people also troubled these terms, did not like them at all, and did not want to oversimplify or label their cannabis use, which makes total sense. And speaking to this cannabis use as a practice of care, one person shared, a lot of people, in the beginning especially, would tell me, oh, well, you're addicted to weed. And it's like, well, I'm kind of dependent on it, sure. Like I use it to ease my life, but I can't go without it. I have gone without it. That's the thing. And I was fine with it. It was just like harder when I wasn't smoking weed. Why would I make it harder on myself? In our third theme, we talked about or we explore how cannabis use is also a survival tool. So sometimes it wasn't just an intentional practice of care, but a really deliberate and necessary tool for survival. And this is especially so for youth with lived and living experience of severe mental health challenges, substance use disorders, most often not related to cannabis, and past and ongoing experiences of trauma and violence. For many of these young people, cannabis featured as an essential source of solace and support that they leveraged to stay afloat and that they felt that they needed to stay afloat. And getting to this, one person, was very explicit, and they say, I don't smoke to get high, I smoke to survive. And really building on this point, another person goes on to elaborate, either you can smoke and tolerate being alive, or you can keep trying to fight and not smoke. But then, you don't know what's going to happen. Address your use in the future, sure, but currently, for me, alive and stoned is better than not alive. So really speaking to the stakes of cannabis use, but also, the issues and inequities that young people are grappling with today. From this really quick presentation, I hope I've been able to impress on you that cannabis use is contextually produced, and really meaning that it is shaped by a variety of individual, social, and structural factors, including experiences of hardship and inequity, and experiences that can really have a profound impact on young people's lives and their substance use. And young people use cannabis for many, many reasons. I've only touched on a few today, but I hope I've been able to highlight that cannabis can be an intentional practice of care, and it can be a deliberate and sometimes necessary tool for survival. When we're thinking about supporting youth who use cannabis, our efforts need to be structurally responsive. And this means that we need to think about not just individual cannabis use or individual behaviors, but the broader social context of people's lives, and really addressing these issues, which from my perspective are of much greater concern. And that is all I have for today, but I'll just thank all of my co-authors and collaborators on this project, and then of course all of the young people who we couldn't do this work without. And I'm really looking forward to the questions and my co-presenters as well. Thank you.
Thank you so much, Trevor. This is just great. And I love when other people are coming to take up the mantle of Trace and join us because you just put into words so eloquently the findings from this project, the continuing work we've been doing with young folks. And thank you to CPHA for including Trace in this webinar today. So just a reminder, folks, we're going to save the questions for the end of all the talks so that everyone gets a chance. And yes, we will likely be able to make slides available. So with that, we shall turn over to our next speakers. Okay, I'm going to turn it over to the team to talk about Substance Use and Addiction Program, the SWAP grant, training youth and young adults to engage peers and make informed, safer cannabis use decisions.
Thank you so much, Rebecca. Good afternoon, everyone. My name is Michelle Johnson. I use she, her pronouns, and I'm a public health nurse with York Region Public Health. I'm presenting to you today from the Treaty Territories of the Haudenosaunee, Mississaugas of the Credit First Nations, and William Treaties First Nations. So today I'm going to present to you our Health Canada funded project that ran from June of 2020 to September of 2022. We worked alongside our community partners to train youth peers to engage with both youth and young adults to make informed decisions on safer cannabis use. We worked with the peers to deliver a safe, unbiased presentation and from a trauma-informed lens to the youth in our community who may have been struggling from either substance use and or mental health issues. As Rebecca had pointed out, I also have joining me one of our peers who we work closely with, and she's going to share some of her experience with the project. Sorry, I'm just trying to gain access to the slides.
Cannot seem to switch them. There we go. Okay, so I thought today I would start
by sharing my experience with Health Canada and what was involved in that process. So initially, we had to provide to Health Canada a lot of the documentation. So we had to outline our outcomes, outputs, and indicators for the 2-year period. We also had to complete an extensive knowledge translation tool, which we did, and then we helped to use that to guide our project. And then each quarter, we had to complete a performance and progress report. And this included things like finances, knowledge products, learning opportunities, and our outcomes. And then lastly, we had to complete an ethics review as we were conducting a project which involved a vulnerable population. Now, I do want to add that we had a really good experience working with Health Canada. They were extremely helpful and they always answered our questions, not just answered our questions, but also they answered them in a timely manner. Okay, so the goal of the project was to increase awareness and knowledge of risks associated with cannabis use, and also to improve behavior and attitudes in youth and young adults on safer use of cannabis. Now, we know that youth respond better to the peers. Therefore, the decision for our project was to involve youth peers right from the start in harm reduction work and to deliver the educational material. They were involved in creating the presentation, the resource materials. They also came up with the social media messaging. They were given a lot of creative leeway, but also ensuring that the information was evidence informed. So as you can see on the slides, there were 4 documents that guided the programming and helped to tailor our workshops. So we used the Talking Pot with Youth, Canada's Lower Risk Cannabis Use Guidelines, the blunt truth, and then the sensible cannabis education toolkit. So to help support our project initiatives, we partner with 5 external agencies. We worked alongside 360 Kids, who was the lead agency and who worked directly with the peers. They led the creation of the workshops, and together we actively promoted the project. All the other agencies that sat on our committee, they were involved by taking on a supporting role. Now, in addition to the 5 community partners, we also work closely with 2 of our school boards. So we had approached them and offered to deliver presentations to their students, as we knew that any one of those students could have been a potentially high-risk youth. Okay, so our primary target population included both the youth peers and the youth audience who may have been experiencing homelessness, youth who were at risk or had a history of cannabis or drug use, individuals from various ethnicities, including the Indigenous population, and youth in our schools. Now, in addition to our primary target populations, we also expanded the workshops to include primary service providers who supported the target population. We felt that there was a gap and that they were able to fill it. They also had the opportunity to hear firsthand from the peers who were able to provide perspectives on how to approach individuals who were experiencing challenges from substance use. So as part of our project, we did conduct a lit review, which took in consideration evidence-informed information. So we looked at things like health concerns, including the impact of COVID-19, reasons for cannabis use, harm reduction, cannabis legalization, stigma, and more. And then we also looked at best practices when engaging youth in conversations about cannabis. And when we did that, we looked at the approach, so looking at public campaigns and messaging, peer engagement, and what worked for other projects or programs. So how did we engage with youth who use substances? Well, we began the process of engaging with those who have lived experience. We did this through the recruitment for the position of a youth peer. We also reached out to our contacts at the Chippewas of Georgina's Islands First Nations to extend the recruitment to the youth on their island. However, we never heard back from them. After we hired the peers, we offered training to them and provided both internal and external opportunities. We also provided them with public speaking sessions so that we were able to help develop their presentation skills as well as their leadership skills. Now, when working with schools and the community youth, we initially delivered the workshops over Zoom or a YouTube live closed channel. And when things started opening up more in the province, the peers started to deliver more in-person sessions, which included our school boards, where they went in to deliver to the alternative classes and to the students who were hard of hearing and required an ASL interpreter. Now, in terms of data collection, all of the youth in the community were asked to complete consent forms, knowledge survey questionnaires, and a post-session survey. And then for the school board, we delivered the presentation through Kahoot so that we were able to keep the presentation responses anonymous. Now, we did collect the same information as we did with the community youth, with the exception of age, sex, and gender, as we were specifically asked by the school boards to remove them due to a violation in their anti-racism policy. Now, for both the community youth and the students, they were able to withdraw from the workshop at any time without any penalty and without affecting their relationship with the peers. However, I do want to point out that we did offer incentives for participating in the workshop. So we offered things like backpacks, t-shirts, water bottles, things that were useful or meaningful to them. And then for the online participants within the school boards, we negotiated gift cards in lieu of material items. Okay, so as part of the community outreach, we also had a social media presence containing harm reduction messages that we posted on Facebook and Instagram, and that ran between May and September of 2022. The peers created the key messages, and we worked with a social media company to ensure that we captured the essence of the messages in our images. We had monthly messages, we had paid ads, a landing page, which could be accessed by clicking on the ads and the messages, and then a 45-second video that the peers created. So just to give you an idea of the impressions, we had about 1.4 million impressions, and our reach was about 99,000. So the next couple slides, I'm just going to show you what the ads actually look like. And that was the last one. Okay, so I'm going to just go over a little bit about the highlights of the workshops. So overall, youth who attended our sessions reported gaining knowledge about safer cannabis use and expressed increased confidence with sharing information with others, where to access support and information about safer cannabis use. Most of the youth stated that they also intended on making safer choices when using cannabis. And then finally, youth overwhelmingly reported that they liked having youth peers with lived experience support them with their educational needs through the tailored workshops. And we did have 6 different versions of the workshop, and that was depending on who our audience was. Okay, I want to share a few points from the feedback that we got from the workshops. And I have to say, this was definitely credited to the great work of the peers. So our school boards and the college that they presented to, they provided feedback on how they valued the information that was presented to them. They said questions were handled both professionally and truthfully, as well. Of course, the high schools, they love the swag. Georgina Island, which is the home to many of our Indigenous population, they expressed how awesome the peers were and enjoyed learning from them. Now, we also had feedback from 360 Kids who led the project. And then we also had feedback from Ontario Works, who's in our social services department. So looking at the limitations and the challenges, one of the limitations, which I think would be of no surprise to anyone, is that the workshops were hard to promote during COVID, as they weren't face-to-face. The target population, they were hard to reach. Now, they're hard to reach at the best of times, never mind during COVID. And then, of course, the high school students, they were also challenging to engage, especially because they were online. Now, I do want to say that our program was sustainable. So one of our partners had agreed to take on the project after completion. And I did share the link on the slide. So if anybody wants any further information about the current existing program, the link is there and we can put it into the chat. And then the last thing I just want to mention is about the recommendations. So the target age for this project was 16 to 25 years. But what we noticed is that we had a lot of interest from individuals who were closer to their 30s. So as one of the recommendations for future programming, we suggested to extend the age group to allow for older individuals, as well as we also thought about offering it to the younger age group. So looking at grades 7 and 8, we thought would be quite appropriate, as this is when a lot of them are first exposed to cannabis. Now, I do want to point out that we never excluded anyone from the workshops. However, we did not count the older participants in our data that we sent to Health Canada. So that is the last thing that I wanted to tell you about. So I want to thank everybody for listening to my presentation. I am going to pass it over to Hareem to tell you a little bit more about her experience with the project. Thank you.
Thank you, Michelle. Hello, everyone. It's a pleasure to be here. So as Michelle mentioned, I worked as a peer facilitator with Michelle and the 360 Kids SUA program. So our role as peer facilitators was to develop evidence-informed presentations and distribution materials, also to engage with the youth through these materials and by sharing lived experiences, and to answer participant questions. So our presentations discussed the mental and physical aspects of cannabis use. We also introduced cannabis use on a spectrum. We talked about the intersection of the COVID-19 pandemic with some of the mental health challenges that the youth experienced. We talked about some legal consideration and harm reduction strategies. So I won't get into specific examples of what we discussed right now, but I'm more than happy to talk about them during our discussion panel. So delivering a lot of our presentations online during the COVID-19 pandemic had its challenges, but nonetheless, I believe that we strive to answer the questions and engage with the audience as best as we could. And we did receive a lot of positive feedback, as Michelle highlighted earlier. Every interaction was led with non-judgment and empathy. I feel, and I still do really feel grateful that the youth trusted us enough to be vulnerable and share some of their thoughts surrounding their cannabis use, and then to also give us some more insight as to what exactly affects their use. One of my favorite distribution materials was when we created a harm reduction resource card, and that summarized some of the strategies that we discussed in our presentations and in our workshops. And the idea was that you could print it out and you could put it on the inside of your phone case. So I think this was one really great example of how we kind of used our creativity, but also our relatability as peers to develop a more practical strategy for improving the use of harm reduction strategies, or at least improving the access to those strategies. The last piece that I like to add is what it was like working with the other peers. So at first I was very nervous because I didn't know what our working styles were and what our leadership styles were like. But I quickly learned how down to earth all my peers were. And the main thing that really got us through was our mutual respect for each other, both in presenting, but also the experiences that we brought into this project and the reasonings why we were there. So because of this respect, we were really able to stay open-minded to each other's suggestions and feedbacks, and we cohesively put together materials to engage with the audience. So that's it for my presentation. I'd like to thank all the participants for listening and my co-presenters, and I'll pass it on.
Thank you so much, Areem and Michelle. It's wonderful to hear from public health practitioners, people trained in the health professions who are trying to work with youth in community-driven and youth-centered ways. And I think that's just an absolutely nice extension from hearing about research that is centering the voices of youth. And now we are going to turn to another project that is youth-driven and unique and community-driven, youth-centering ways. And I'm thrilled to introduce Kia Noor from Get Sensible.
Thanks so much, Rebecca. And thank you, Hareem and Michelle. Love the peer-to-peer approach that you took in your project, as well as identifying, and we can get into this later in the conversation, but identifying youth older than 25. That's something with Get Sensible that we definitely noticed, that our target demographic was 17 to 25, but I would say that there's a lot of young people that need support under the age of 30. So very good points. So hello, everyone. My name is Kia. I'm a co-project lead on the Get Sensible project. In French, it's Pensez Sensé. Sorry, Kelsey, I don't know if I have controls.
You should be getting control, I think, now, or we can flip the slides forward. Awesome, thanks.
That's perfect. Thank you so much. So Get Sensible is a project out of Canadian Students for Sensible Drug Policy. On the panel today is me, Kia, and my co-project lead, Noor. So Get Sensible is made up of young people from different backgrounds with unique experiences and perspectives. Noor and I are just a drop in the large puddle of what Get Sensible is. So you can see up here we have Heath Alessio and Hunter Tremblay, who are the other project leads, as well as some of our peer leaders on the screen there, web developers, graphic designers, translators. We have a really large team. And what's really neat about Get Sensible is everyone on the team is a youth themselves. A majority of people on the team are folks with lived or living experience. The goal of Get Sensible is to include youth at the center of substance use, health education, and mental health education, as well as creating a really strong network and supportive network for young people. So about CSSDP, so Canadian Students for Sensible Drug Policy is a grassroots network of young people and often students who are concerned about the negative impact that our drug policies have on individuals and communities. And CSSDP acknowledges that the impacts that our drug policies have on individuals in our society, advocating for an evidence-based approach to education and drug policy reform. So Get Sensible is younger than CSSDP. CSSDP has been around for over 15 plus years. Get Sensible is a project that was initially funded through SUAP as well, through the Substance Use and Addictions Program via Health Canada. Get Sensible is around 3 years old and received funding in 2020. So aligning with Canadian Students for Sensible Drug Policy's mandate to support drug education efforts and building upon youth consultations and cannabis legalization. The Get Sensible campaign responds to calls for the development and dissemination of realistic evidence-based cannabis and substance use education for youth. And our main pillars of our campaign is to have evidence-based strategies and information to substance use education. We really like to take a harm reduction and anti-oppressive lens, as well as centering and elevating those with lived or living experience. As I mentioned before, same with Michelle and Harim's project, that we really, really love to take that peer-to-peer approach. People with lived experience have so much to share and are the true knowledge keepers when it comes to harm reduction, in my opinion. And above all, we really like to make educational materials accessible, representative, and fun. So Get Sensible, we have quite a few ways that we engage with folks. So one of our ways is in-person engagement. And as many other people on the panel, COVID-19 did make that initially quite difficult. But in recent years, we've been able to engage in local communities and elevating the CSSDP chapters, and as well as collaborating with local organizations. So we've been to Halifax. We had a panel event in Halifax at the Halifax Psychedelic Society. We've been to Vancouver, and we've had a pop-up beach hang where we share our resources and provide young people with food. We really like to take the meeting young people where they're at, so really seeing where are they going. So we have had a couple of skate sessions where we provide food for young people, as well as sharing resources in different skate parks around Canada. And our most recent in-person outreach was in Vancouver. We collaborated with the CSSDP Vancouver chapter, as well as Caitlin Donahue, who recently wrote a book called Weed, Cannabis in the Americas. And so we hosted a really lovely event called Drug Tales, where people could share their substance use related stories in a safe environment. And then as well, a large part of Get Sensible is our online engagement. We have been able to reach over 4 million young people around the world via different social media channels. We have quite a large Instagram presence. We're available on TikTok and as well as YouTube. So if you're on this call today, I really recommend you check out our Instagram. We have fun giveaways, but above all, we also have really great harm reduction tips and tricks that we provide. Some of them are focused around cannabis, but we do try and talk about substance use more broadly. And then on our YouTube channel, we have an expert video series that you can see down there. We have a Kwasi talking about cannabis laws and your rights and about cannabis amnesty. And then we also have a community conversation. So here you can see the multitude of Black experiences with youth and weed. And creating conversations. So Get Sensible creates space for conversations about cannabis that happen without judgment, shame, or stigma. We really try to reduce stigma for young people to share their experiences. I feel like you see it in our resources where we are really trying to meet young people where they're at, but also be realistic with the issues that young people might be facing or the concerns that they might have around substance use. So here you can see is an awesome conversation with some queer and trans youth that we have, a part of our community dialogues. We also have a Get Sensible Discord where we invite young people to join in the Discord, and people throw memes in there and just exchange different harm reduction tips and tricks as well. And then I'll also share our Drug Buds podcast, which is a podcast created by CSSDP, and Get Sensible has been featured on a couple of the episodes as well. So it's just different ways to exchange knowledge and build community. And I'll move more towards our resources. So in 2016, CSSDP facilitated a roundtable in Toronto talking to young people, I believe it was around 21 young people, about any concerns they might have around cannabis legalization. So when we were chatting with young people, they said that they wanted evidence-based education. They really wanted harm reduction messaging that moved away from the abstinence-based approach that we've all quite familiar with. They wanted the conversations to be youth-led, and having that lived experience angle once again was really crucial for them. As well as having youth playing an active role in their own drug education. So that out of that roundtable, our main resource came, which is the Sensible Cannabis Education Toolkit. And I believe Michelle had it mentioned in her presentation as well. So this like really filling in the gaps, building on that CSSCP Sensible Cannabis Education Toolkit was created. And so with the SUAP funding that we received a few years ago, the Get Sensible project was created. And what we did, the main mandate of the SUAP funding was to redistribute the Sensible Cannabis Toolkit and spread it across the country. But we took a pause on that and we decided to do a toolkit redesign, make it more accessible and more appealing to young people. So instead of one toolkit, we broke it into 3 booklets and divvied it up depending on the demographic. So you can see here we have the guiding principles of education. Now this can be used for young people or youth allies, different ways that you can engage in conversations around weed, different ways that you can open up dialogues and ways to teach either young people or peers about weed. And then in the middle there, we have Cannabis 101 and harm reduction. So in here, it's very personal. There's harm reduction tips. There's also notes at the back of this booklet where you can reflect on your own cannabis use. So I kind of see it as like a cannabis diary in a way. And then cannabis in context. So here there's emerging research around cannabis can be found here, how it plays out socially and in your personal life. And on the screen here, this is when Get Sensible went on tour, I believe it was in 2021, and distributed the resources around to some folks in our networks. And this just, once again, is showcasing the Sensible Cannabis Education booklets, which are available for free on our website in PDF format. Oops, sorry about that. So I'll pass it off to my colleague, Noor. Thank you.
Thanks, Kia, and thanks to Rebecca for that great introduction and all of the other panelists for their amazing work. So I'm just going to jump into the evolution of some of our resources. So this is kind of a timeline of the progress of them. As you can see, we have the initial toolkit, which looks a little bit clinical. And then we have really beautiful redesigned versions, more accessible for youth. And we also created some zines that are also available for free on our website to print in PDF format, just addressing different topics for youth. Like the one on the screen is a guide for not greening out when using cannabis, and also includes ways to support someone else and when greening out might not be greening out, and when to reach for more help. Then, as Kia mentioned, we also have our YouTube channel and podcast. So the goal is really to meet young people where they're at in different accessible ways in the platforms that they use. So whether you're an audio person listening to podcasts or more visual, wanting a video, or wanting to read about it, we really try to diversify the resources that we have, and also to make sure that the language that is used is relatable for young people, and also presented by other young people and people like community members that they can relate to. I just also wanted to highlight that in the YouTube, there's lots of very cool community conversations looking at experiences of different groups. Like Kia mentioned, there was the video centering Black youth and their experiences with cannabis. And there was also one about trans youth who are also disabled and their experiences with cannabis. I think it's important, as Trevor mentioned in the highlights of the TRACE study, the inequities that young people face are impactful on their cannabis use. And so we really try to address different topics related to that. So it's not just like cannabis education, but also looking at intersections of cannabis and mental health, cannabis laws, like knowing your rights, And there's even some information about mixing substances with cannabis. And as you can see at the end of our timeline, we have our brand new resources with CPHA. So I'm going to talk more about that. Sorry, I'm trying to change. Oh, there you go. All right. So for our 2023 youth engagement, we partnered with CPHA to, oh, I think I'm missing a slide. Okay, that's okay. So yes, this year, 2023, in April, we partnered with CPHA to create a brand new set of resources, expanding from cannabis to support young people who use drugs in general, and looking at their experiences of navigating healthcare systems specifically. So we collected information using online surveys and focus groups, and we recruited participants mostly from our social media, mostly Instagram. And this project was also facilitated using a peer-led approach. So we kind of emphasized that in the recruitment that, you know, the Get Sensible team is composed of young people who use drugs, and that the focus groups were also facilitated by young people who use drugs. Some of the results that we got from the survey is, so we had a total of 41 young people filling it out. And I just wanted to highlight some of the big intersections that they're experiencing. So 80% identified as LGBTQ2IA2S+, and 88% also have experienced mental health concerns. 78% felt stigmatized or judged by healthcare providers for their substance use, and 42% said they would be unlikely to feel comfortable disclosing their substance use to healthcare provider. So kind of the aim of our project and new resources is to create a guide for healthcare providers on how to better engage with young people who use drugs. And also, as a companion guide to that, we have some resources for young people on how to navigate the healthcare system. As you can see, stigma is really the biggest barrier. This is a quote from one of the participants that says, stigma has made them very hesitant to disclose substance use to healthcare providers. And then some of the recommendations that young people said that they would like to see implemented within their healthcare is definitely harm reduction. So young people really stress the need for healthcare providers to have harm reduction knowledge and to understand safer substance use alternatives to abstinence and non-punitive approaches as well. Young people said they definitely felt more comfortable when they were presented with these options. Also, of course, non-judgment was a big one. So just making sure healthcare providers keep an open mind and ask questions and are open to listening to young people. Keeping in mind that a lot of our population of young people is going through other challenges, not necessarily linked to their substance use. So trauma-informed care was also a big highlight, and kind of emphasizing that healthcare providers recognize the connection between trauma and substance use and mental health as well. And then one big recommendation as well was for providers to really understand diverse experiences and to have some cultural competence to be able to provide different solutions based on different groups of young people. And another important part was to include young people, have peer support approaches, and include others with lived experience in engaging young people and maybe providing them with mentorship and guidance or just general information on how to navigate these systems. And then lastly, young people really emphasized that there is a lack of respect for their agency and autonomy when accessing healthcare services. So that is something that we are working on in our report to help healthcare providers understand and give young people power and agency in making their own decisions and seeking out health care services that are appropriate for them. So please stay tuned for our upcoming resources, which are going to be on our website as well. We already have a checklist for healthcare providers on there of just best practices and recommendations for engaging with young people who use drugs. And we also have a zine for young people on how to navigate healthcare systems with some like red flags for healthcare providers, practical phrases that you can use to set boundaries and information about your rights as a patient. So those are available on our website currently, and the final version of the report with the full results is currently being reviewed by our research advisors and will be published soon. And these are just pictures from our most recent outreach where we distributed the zines and healthcare provider checklists. So we were on Vancouver Island, visited UVic, tabled there. You can see the picture with Kia and Heath. We also visited Vancouver and tabled at UBC, where we talked to students and also collaborated with the CSSDP chapter to host Drug Tales event, which was very cool. As you can see, Heath here is dressed in their ferry facilitator outfit and was hosting the Drug Tales event, which was really cool. And we also met up with other harm reduction organizations like Aware here in Calgary, who have a drug checking van. This is our team posing with the drug checking van. We also hosted like an Instagram just sharing content from the drug checking van to bring awareness and education to youth across the country. So yeah, this is our most recent outreach. And lastly, Get Sensible really emphasizes community-based education. Like one of our pillars is making these resources to be fun and engaging, and recognizing our grassroots approach to activism. So these are our wonderful new stickers that we also distributed in our most recent outreach, and were designed by young people involved in our campaign, and we use them a lot to just bring attention to our project, and they're just so fun. People love them in outreach. So it's just one way that we engage youth as well. And I think that is all that I have. So here's our contact information and our website and all of our socials where these resources are available. Thank you so much.
Thank you so much, Nora and Kia. And I was thrilled to be able to hang out and have pizza with Get Sensible when they rolled through Calgary. And it's just refreshing and a great reminder of the tenet of drug user activism and harm reduction that guides much of our work, which is nothing about us without us. And so if you don't have young people using drugs at the table, you know, we're missing a massive part of the picture. In fact, that is the picture that we need to center. So thank you so much for Get Sensible for that presentation. I feel really energized and inspired, not expired after hearing from this group. So I hope you do too. And I know people have had some questions. So we're going to be moving to that in a minute, I understand. So I saw some people with their hands up, so maybe CPHA can give me some guidance if you want to let those people take the mic, or shall I read some questions, or how we might like to go from here?
Yeah, whatever you're most comfortable with, Rebecca. I think there are a couple folks that had their hands up, so we can believe give them permission to unmute, or if those folks would like to just post their questions in the Q&A, either is fine. I think there is one question posted in the Q&A right now.
Yeah.
We want to start there.
Yeah, okay. I think I've sent this to Trevor, but I'll read it for the participants. It says, Lisa would like to know, did youth express a desire for alternative supports, accessible, affordable therapy? This is alternatives to using cannabis when they're talking about cannabis as a strategy. And did you say that they would continue to use even if they had other supports available?
Yeah, thanks, Rebecca, and thanks, Lisa, for starting us off with that question. It's a two-parter. So for the first part, did youth express a desire for alternate supports? Absolutely. Folks really said loud and clear that they needed improved access to mental health supports, especially like supports that are not covered by insurance, and many folks do not have access to insurance or good insurance. So like free to low cost counseling. People also asked for supports outside of like the mental health system or the healthcare system. So like, gender and sexuality alliances in their schools, anti-racist workplaces, more funding and support for like community groups and hobby groups and so on. So like a range of supports to promote their health and well-being. But I would stress too that many people did not talk about wanting these supports like instead of cannabis. It was often like in addition to cannabis, like they weren't really pitting these supports against each other. And then your second question, did youth say they would continue to use cannabis even if they had access to those supports? I think that really varied like person to person. For the most part, people did acknowledge that, yeah, maybe having a different, set of circumstances in their lives and their workplace, education, access to healthcare and so on, that would likely have an impact on their cannabis use. But not many folks said like, they would stop using cannabis altogether. Some did for sure, but for the most part, it was just that acknowledgement that it would have an impact, and they would kind of play it by ear in terms of tailoring their cannabis use in relation to mental health and what was working for them.
Thank you, Trevor. There's another question that popped up that is going towards Get Sensible. And I think Nor Kia can answer if the drug checking ban, is it drug testing strips or is there access to mass spectrometer here? And they said, awesome work, keep it up.
Thank you. So the local drug checking van in Calgary does have a spectrometer, and they also have test strips, which is really cool. They actually have xylazine test strips, which I've never seen before. So that was really interesting. In addition to the fentanyl test strips, but they also do have the spectrometer. So you can get pretty accurate percentages of what the substance is. And yeah, they are free and no questions asked and available for anyone to access in Calgary.
Thank you, Nora. I see Teresa and Karen have had their hand up for some time, so I'm going to allow Teresa to talk, or maybe if you don't want to speak, you can put your question in the Q&A. Maybe. Trying to be democratic here. What about Karen Cullen, who's also had their hand up with a question? Okay. Please circle back and put something in the Q&A. But I see another questions come in through someone who wants to remain anonymous right now. And they're saying, curious, particularly for Get Sensible, but open to everyone. Where do folks see the future of drug education going beyond cannabis? So I guess a broad question everyone can ask. Let's first throw it to Get Sensible, and then we could also hear from Michelle and Harim and others.
I guess I'll start. I love this question because I definitely think that it doesn't stop at cannabis, just like substance use education doesn't stop with alcohol. It was interesting though, because when we were touring around with Get Sensible in BC and Alberta this year, shockingly, it seemed like a lot of young people, their interests. So a lot of young people approached our table and they were asking if we had resources around alcohol education and substance use education around psilocybin, so like magic mushrooms. But the alcohol piece surprised me still. So there's definitely still gaps in knowledge when it comes to substances that have been legalized for a while and, you know, might be more socially acceptable. So I definitely think that the future of education, substance use education, I mean, my dream is, and I think for Get Sensible, I don't want to speak for everyone on the team, but we really want to make sure that we're having a conversation that doesn't exclude any substances or individuals that might use these substances or are curious to it. So I think the model that we use for CSSDP and Get Sensible, where we had focus groups and roundtables, seeing like what is missing in their gaps of knowledge, what are young people wanting, and then creating materials, print, virtual, and otherwise, based off of what young people are wanting, is a really, really great approach. It's kind of vague, but I guess, like, yeah, continuing the conversation, hoping that folks can support us in that. But young people are really wanting more, and it's very obvious that it's great that we are having education around cannabis, and I think it's really important. But yeah, young people are curious and also excited, which is awesome. Like, young people are really excited to learn. So yeah, I'll pass it off to Nor if you have anything to add.
Thanks, Kia. I would echo everything you said, particularly around the alcohol piece, because from my work on campus in like post-secondaries, from what I've seen and heard from students, it's really something that's not talked about at all. Like, there's no such thing as alcohol harm reduction, and very basic, you know, tenets of it are not known to most students, even though that's something that they engage in very regularly and like most people in their circle do. So definitely an emphasis on that, and the psychedelics piece, mushrooms in particular. And then I think also from what I've heard from students and young people in general is they are looking for supports on how to support a friend. So it may not necessarily be for them, but they are looking for resources on how to talk about, you know, when substance use might be becoming problematic, when it's not, like when you're experiencing negative consequences and like noticing that in a friend or colleague. So that's been a resource that young people have also been asking for, how to support others.
That seems like a fantastic segue to hear from Michelle or Harim about peer support, because this is what your project was aiming to do as well. So maybe you want to weigh in from that lens.
Yeah, so that was a question that we did get a lot from our peers. We talked primarily about cannabis. We got a lot of questions about psilocybin, LSD. And I think there's a few pieces to consider when we want to talk about supporting peers and answering their questions and providing them kind of the information that they're looking for. I think one of the main things we definitely have to consider is that the political climate definitely does impact which organizations are willing to kind of collaborate with youth and peers in having these conversations. And so we see some organizations, for example, like the UHN, who are coming out with psychedelic psychotherapy research, and we're hearing a lot more about ketamine use, for example, in treating trauma such as PTSD or CPTSD. However, still these conversations are kind of constricted by that political climate. So I think that's one piece we have to consider. The second piece is that I think as researchers, as youth workers, as community organization workers, we definitely have to push out for more or advocate for more of these conversations to be had, to talk with these organizations and kind of create collaborative spaces for youth to safely have these conversations. And I think in that way, we can definitely start to create some educational resources and more movement forward towards including other substances, decriminalizing substances and demoralizing substances, and have more productive conversations surrounding these.
Michelle, did you want to add on to anything? I think that was very eloquent and captured it so well.
I'm not even sure I can add to everything. You guys really covered everything, but I really do agree with just everything that everybody is saying in terms of more conversations about supporting their friends and just really getting more in depth with it and working collaboratively. I think it's really important that we're really inclusive. And that's the one piece I think that we did really well with our project, is that we made sure that it was very inclusive. We wanted to hear from everybody. So I don't think I can really add to what everybody has said, but that's kind of, I guess, sort of my summary of it.
Yeah, appreciate that. I want to switch gears now to a question from Daniel Bear. Hi, Dan. About evaluation, since I'm a research nerd. How are people evaluating these projects? And so we've seen the projects spanning from, what I would call community-based research into, applied public health practice, and then like really on the ground community outreach. And we have different ways of monitoring our progress and reporting to our funders and back to communities. So if maybe folks wanted to weigh in at a high level about how do you show impact of your work?
I can just tell you from our project itself, we did a lot of collection of a lot of data collection through survey questionnaires. So when we were working with youth in the community, obviously we wanted to make everything anonymous, but we wanted to collect the information, in a meaningful way. So we did have questionnaires. With our school boards, it was a little bit different. We had a bit of a harder time collecting that information, which is why we went through Kahoot. So we were able to collect the exact same information. We had some parameters, but we were able to collect that information. So for us, we really focused on that questionnaire. And just, we did a lot of collecting information, not only, we did some collection of information while we were in person. So it was just getting to know people and then taking that information and being able to apply it. I wasn't formal, obviously, but our survey questionnaires were definitely the formalized way of doing it.
Trevor, I'm going to put you on the spot as a research doctoral candidate. Do you have thoughts about like youth friendly evaluation and research data collection?
Yeah, it's interesting. And I guess I'm speaking more generally, since our trace study wasn't necessarily about like resource development or whatnot, but we did in our focus groups kind of run by youth these different projects and resources, and we got like a diversity of perspectives. And you mentioned youth friendly. Some of the young people we spoke with really valued kind of like youth friendly, fun resources, and especially like those kind of destigmatizing resources. And felt that was kind of a nice contrast to a lot of the top-down kind of paternalistic resources they were used to. At the same time, other youth like did not like those and felt it was kind of like making light of their cannabis use, or they felt that they needed a more like quote unquote scientific resource. So I think in terms of our broad conversations with youth, we really found that youth need a diversity of resources and kind of information sources when it comes to cannabis and other substances, and like no one resource is going to work for all youth. But if we're if we're including youth from the get-go in terms of like design and testing and dissemination of these resources, that's where I believe they'll be most impactful. But yeah, curious if others have anything to add there too.
Yeah, I would say I'll just tack on from another question that's in the chat there. They're also asking about data beyond substances, like how do we know who we're serving in our work around housing and food insecurity and family dynamics and all of these things. And I don't know if we have a clear answer to that, but I do think what you're pointing to is that we always need to get upstream, right? We're not just focusing on substance use as an outcome. We're looking at the context and everything else that wraps around the person and their community. So I think that's a really good reminder. And then go ahead, Kia. Yeah.
Rebecca. I was just going to share on Get Sensible's behalf in terms of eval. Is that all right?
Yeah.
Yeah.
Okay. Yeah.
So I guess when we were funded by Health Canada through the Substance Use and Addictions Program, because our main mandate or deliverable was disseminating the toolkit, a lot of our evaluation was based off of the amount of resources that were given out. So we printed a lot of our booklets, and we had numbers around there, and then we took count of the location that we disseminated the resources in, the age of people that we disseminated it to, whether it was young people directly or to youth allies. And then as well on our website, we can gauge the amount of number of downloads on our website in terms of the zines and booklets, and then as well as social media, which is like really fortunate that, you know, we do live in that digital age, and some of our resources are able to be shared. I mean, I don't want to speak for all the projects on the panel, but I know having a project that's around cannabis, sometimes there's censorship online that can be a bit difficult when it comes to sharing these resources. But really love what you're saying, Rebecca, or asking Trevor about in terms of making eval accessible and fun for the young people that we're engaging with. And I think something that we like to do is having like exit interviews, if people are open to it, feedback surveys. Some folks really like doing surveys, other people would rather it be a conversation. So really making it accessible for folks. But yeah, it definitely depends on the funding body and what they're expecting in terms of that.
Okay, thank you. I'm just looking at some more of the questions. I mean, people have some really on the ground practice oriented questions for Get Sensible. And I think it applies to all of us here. Like, what's your advice for people who want to do peer-led projects in the community? You know, and how are the peers trained? How do you recruit people? These are the questions that people seem to be interested in doing this and where they are.
I could give some quick advice on engaging youth. What Get Sensible, we really try to meet them literally where they are. So, like we did a few that Kia mentioned, the skate park sesh in Calgary, and like the beach in Vancouver, and also like tabling on campuses and stuff. But I think really just figuring out where young people are in your community and creating space there to engage with them, and also like bringing food, other ways to compensate people, like pay young people. Those are definitely some best practices, I would say.
Mm-hmm.
And for recruitment, I would say social media goes a long way. And if you're able to connect with maybe another account who has a big following and have them kind of share and recruit from there, that's kind of what Get Sensible does. So.
Yeah, I know Get Sensible was invaluable to our recruitment through Trace. So I think it's about building those networks in the community on the ground, but also the cooperation of adult allies, you know, in policy positions and working in organizations in healthcare and in schools and in our public health practitioner realm. Like that is key to cultivate those, to find those allies who are willing to support and sometimes go out on a limb when it puts them in a spot to talk about harm reduction for youth, which not everyone is open to that conversation, right? And so this brings me to another question. You know, people are really interested in how folks working in policy, health and social services, public health, and the justice system ensure that youth are engaged and meaningfully involved in decisions that impact them. And I would open it up and almost flip it to folks like, can you give some examples of what goes wrong when youth are not at the table? The really bad drug education, I think, is one great example. I can always tell when something comes out for cannabis or something else that zero youth were consulted, right? For example, I always use the example from the Quebec Psychiatric Society, who called people using cannabis, you know, a lazy eggplant, and they used a big eggplant. But of course, for young people, eggplant means something very different if you're aware with emojis and social media and how youth text, right? So this is just an example of a huge misstep. Calling people using cannabis lazy eggplants, I don't think is productive and very out of touch with youth culture. I'm not going to go into it. You can look it up. So with that little, you know, anecdote, I'll open it up to others to talk about how we go wrong and how to include youth better.
I can talk a little bit about, well, it's kind of a pitch, I guess, for our health unit. But one of the things that our substance team does right now is they have a youth peer-led programming, which basically it has 3 different modules. Our public health nurses, they go in and they train the peer leaders on various topics, not just cannabis, but it's included. And then basically with the peer leaders, who usually are grades 11 and 12, they present to the younger grades. So they're going in and they're presenting to the grade 9, 10s. I think that's sort of I guess that's one of the ways that they can really encourage the peers to get involved. And of course, our SUAP project was definitely one of the ways that we got peers involved in terms of missteps. Well, there's a lot of ways, as you said, there's a lot of ways that there can be missteps on this. But I really think, in terms of, it's important to make sure that you capture their ideas and have their input on everything. I don't know how you could have a program that doesn't include them, in all honesty. So that's just my little plug.
Thanks, Michelle. Anyone else want to weigh in?
Yeah, I would say, as a youth myself, I think visuals and the way that we actually present the information is really important as well. You can't kind of, bring education or information forward to youth without first garnering their attention or gaining their attention towards these materials. And so I think even in the 360 Kids SUAP program, we focus a lot of our attention on the colors, the fonts, the way the information was kind of looking on a presentation or on a resource card or on a workshop slides. So I think that's a really huge thing. You can kind of tell when it's not made by youth. It definitely doesn't have that same kind of the themes that are ongoing, like in the current youth culture right now, in terms of like the fonts and the colors that youth engage in. And I think Noor and Kia kind of talked a lot about this, where they had this toolkit or this document that looked a lot more clinical at first, and then as time went on, they had these materials that actually spoke to the youth a lot more. So I think that really shows how they collaborated with the youth in creating these materials.
Yeah, I think that's a great example. I'm getting the signal that we need to move to final thoughts. So maybe I could pull people for their final sentence, or if you want to share your one last thought on this. I'll just say I'm very inspired and grateful to everyone. But any speaker who wants to close with a final thought.
I'll start. I guess thank you all for being here today. And I guess the way that I approach substance use education and education in general is to come at it with an open heart. And it's kind of cliche to say, but mistakes can and will be made, and it's totally okay. And the fact that you're here and willing to learn and are open to learning is such a great step. And just a reminder that young people are also experts, and education goes both ways, so we learn from each other.
I can go next.
Yeah.
Nora, did you want to go next?
You go ahead.
Okay, sure. I'll be like that. I think we've had a lot of really good conversation today about putting cannabis use in context and thinking about other substances as well. And yeah, I think we've learned a lot from this conversation about also thinking of the full spectrum of approaches to supporting youth who use drugs. And today we've highlighted harm reduction as a key pillar on that spectrum, but also we need, broader investments in evidence-based approaches to prevention, treatment, et cetera, and really addressing the social issues that are affecting youth and substance use today. And I'll end it on that, and over to Noor.
Thanks, Trevor.
Thanks everyone for being here today. And I would kind of just echo what both Kia and Trevor have said. Listen to youth, involve them in every step of the way. Even with our project, after the focus groups, we do present the report to young people and healthcare providers to kind of do a member check-in and see if this resonates. So yeah, listen to young people. As Kia said, they are the experts, and give them agency and power in making their own decisions. And they also have really amazing ideas on how to engage other young people. And yeah, keep an open mind and stay educated and aware of what's going on as well, and also keeping in mind intersections and different identities that lead to different inequities within substance use and navigating resources. Thanks, everyone.
Guess when you're almost last, it's really easy to, to say everybody covered everything. But I really want to highlight what Nora said in terms of, listen. It's really important because they are the experts. Keep it real. Okay. And for me, don't exclude youth. I think that's coming from this project. It was something I had never done before. And for me, it was one of the highlights, and just working with the youth and working with, listening to everybody. It was an incredible experience for myself. And although I don't work in the area anymore, I think you guys are doing an excellent job, and to keep up the good work that everybody is doing.
Irene.
Yeah, I guess I'm last. I think two key things I want to mention is, first thing is just to keep an open mind. The more that we kind of engage in this kind of work, or we engage with youth, these experiences will kind of formulate how we will engage with youth in the future. But I think it's important to keep an open mind and to continue learning from the youth. And the second thing I would say is that continue to educate yourself, whether that's through speaking with youth, or whether that's through some of the other resources that we have, that we're really privileged and we're grateful to have access to.
Wonderful. Well, nothing further from me. Do Kelsey and Alexi have closing words?
Yes, I can share my screen just one last time. First and foremost, thank you everyone for being here and for sharing all of your great projects. We got to hear from youth engagement, both on the research side, the program, public health programming and development side, as well as the more direct primary care and targeted approach to healthcare providers and youth who interact in these systems. So again, huge thank you to all our panelists, and a big thank you to you, Rebecca, for moderating the discussion. I think there's a lot of great expertise here today, and it highlights the need to continue pushing for these conversations, and we appreciate you engaging in these conversations. As a final reminder to anyone left on the call and those who will be watching the recording, we have a final webinar of our fall series on November 29th at 2 p.m. Eastern, and it will be on the newly released Beyond Stigma video, Beyond Stigma, Strength in Connections, which examines the stigma that can be experienced by and from families, peers, and friends of people who use opioids. So we look forward to seeing you at that webinar. And like I said previously, a recording, slides, and transcript will be available in just a few days from this webinar. And with that, I will stop sharing and end the webinar. I wish you all a great afternoon or a great morning for those in the West Coast. Thank you so much.